Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll, and this right here is the healthiest half hour anywhere online today. Appreciate you joining us here on Facebook and on YouTube. I don't know about you, but it feels like fall today, so let's see if we can warm things back up with a hot show. So, coming up today, when it comes to your heart, is exercise or diet more important to keeping it beating healthfully? We'll be weighing in workouts versus takeouts when I'm joined by acclaimed cardiologist Dr. Kim Williams. Now, also on the show today, Dr. Jasmol Sardana is here. We're going to open up the doctor's mailbag and field your questions. All things related to diet, health, and nutrition are on the table. You see her right there. Dr. Jazz, you ready to answer some questions today?
I am. Nice to see you again, Chuck.
Pleasure is all mine. So you who is watching this right now, my exam roomie, go ahead and post your question in the comment section now, and Dr. Jazz will be back to prescribe some answers in just a little bit. But first, here are your health headlines for this Tuesday, September 15th, 2020. States that have relaxed coronavirus restrictions have seen infection rates double within 3 weeks of reopening bars, according to an analysis by the Washington Post. Even at limited capacity, scientists say they can still be hotspots for transmission. 1 out of every 5 coronavirus cases in Colorado and Louisiana were traced back to a night out for dinner and drinks. And in San Diego, that number jumps to 1 out of every 3. Scientists chalk it up to the airborne nature of the virus, one telling the Post, quote, "People go to restaurants to talk, and we know that it's talking that produces 10 to 100 times more aerosols than just sitting. Aerosols are the tiny droplets that can carry the virus and come out of a person's mouth when they speak." Meanwhile, the World Health Organization says Sunday saw the highest single-day increase in cases worldwide, with more than 308,000 new infections being tallied. India, Brazil, and the U.S. reporting the most cases. As of today, there have been more than 29 million infections worldwide reported since the beginning of the pandemic, including more than 6.5 million in the U.S. And finally, in nutrition news, new research is showing that certain compounds found in soy could prove beneficial during the treatment of bone cancer. The Washington State University study finds one particular compound in the popular legume can reduce cancer cell viability by up to 90%, while 2 other compounds significantly improved healthy cell growth. Interesting and promising. Let's move on now. The recipe for a healthy heart can be quite simple. Eat a healthy diet, and get up off of the couch. But which of the two is more important? For an answer, I turn to the former president of the American College of Cardiology, who also happens to be a tennis pro. Dr. Kim Williams is someone who understands both sides of this healthy coin, and he and I recently had the opportunity to chat on the Exam Room podcast, where we weighed the benefits of eating right and compared them to exercise, and how the two can actually work together to increase the benefits of each. We looked at this from both the standpoint of the elite athlete like Serena Williams and from those who cheer her on from the sideline before lacing up their sneakers and hitting their home court. Now, we know that changing your diet can help to reverse heart disease, but can you, in fact, lace up your sneakers and outrun a clogged artery? Let's find out now with Dr. Kim Williams. What about those weekend warriors, who go out there and they have delusions of, running onto, the stage at Wimbledon? But in reality, they're just in a neighborhood court. It happens to be a hard court. I don't know of many grass courts here in the U.S., Dr. Williams. But bottom line is, how does nutrition help those players in terms of cardiovascular health? Even though they're just playing Saturdays, Sundays, whatever the case may be.
Oh, I would say it's indirect, but it's absolutely huge. I mean, this is the area where we could have some of the most good. One of the biggest problems with athleticism as you get older is injury. And sure, plant-based athletes get a few less injuries, and they recover faster from the injuries because there's not a lot of serum inflammation going on. Okay, and that's been shown over and over again. Even our keto opposition can't argue that about the inflammation data. They may not know about it, but if you are keto and you're listening, saying here goes Dr. Williams again, anti-keto, well, it's really anti-bad outcomes. And so please take a look at low carb diet and inflammation. And so when people, even eating the American Heart Association diet, I don't mind talking about it because the American Heart Association published this data, that AHA diet versus a vegan diet, you see a dramatic drop in inflammation with vegan that you do not get when you're doing an American Heart Association diet that includes animals. And so it's pretty well-known data. Okay, so inflammation is one thing that should help your recovery and from injury. Now, the other side of it is weight. And there's blood pressure, diabetes, high cholesterol, okay? But obesity is the number one thing that leads people as they're older to more degenerative joint disease. And then you get into this spiral. Well, I'm not exercising because it hurts, and it hurts because I'm gaining weight. And the gaining weight is because I'm not exercising. And you end up in this spiral, and the only way out of that is nutrition. People need to lose the extra pounds, get to the ideal body weight. They'll feel stronger, they'll feel faster. And if you can get to the point where you could, taking advantage of last week's European Society of Cardiology meeting, take advantage of high intensity interval training. So I have patients today saying, oh yeah, I walk 3 miles every day, okay, but I'm still feeling fatigued. I say, well, walk 2 blocks and then run 2 blocks and then walk 2 blocks and then run 2 blocks. While that literature that was published last week did say that after a year, the people who do the slow training versus the people who do the high intensity interval training are at the same spot at the end of a year. But during that year, the high intensity interval training people get stronger faster. And that's really what you want. That's the success that keeps people going. So I'd say it's really important to get your risk factors in order, particularly during the time of COVID, where obesity and hypertension and diabetes leads to worse outcomes. But also for athletic performance.
Well, let's talk brass tacks then. I mean, is it even fair to say diet is more important than exercise, or vice versa? Is there, a champion when it comes to cardiovascular health?
So it really depends on. So for cardiovascular health, I would say nutrition is going to win that battle. It may be a 4-to-1 or a 5-to-1 ratio. That is putting bad nutrition in, and it depends on what kind of nutrition it is. Does, the American Heart Association diet or the Mediterranean diet with more chicken and fish is not as bad as if you're eating the processed meat and the really high, high saturated fat, mixing dairy and meat together. There are, and refined carbohydrates. You put all those things together that so many of the athletes are eating, and the long-term outcomes are not good. When you raise that insulin level from that hamburger bun and then you're eating the cholesterol and the like, you're developing plaque, you're developing central obesity, you're developing insulin resistance, okay? But insulin is a growth hormone, and people will put on weight, they'll put on muscle mass, and they'll feel like they're getting stronger when they're in interior alignment for the bears. But then, when they're 50, then they pay the price of that plaque. And you see the longevity of some of the professional athletes that focus on that kind of eating, not really doing well. So I'm hoping that everyone will realize the power of plant-based nutrition and adopt it for their long-term health, not just short-term athletic performance.
Wow, I mean, 5-to-1 ratio, that's it really, I mean, that speaks volumes. And I think maybe a lot of people get tripped up because they think, well, I can exercise away those pounds, and as long as I'm, not carrying that extra weight, I'll be okay. But we do know with the plant-based diet that can reverse heart disease and help actually unclog those arteries. But correct me if I'm wrong, you cannot outrun a clogged artery.
And so it turns out that when people exercise, even though you've seen some famous cases, starting with Jim Fixx in the 1977, people who are running, and end up having a heart attack. In general, it does help you. It's so-called a prepared muscle set, because the arteries, as they're closing, if you're stressing it every day and exercising it every day, you try to develop those small channels called collaterals. And getting collateral blood flow will allow people to actually do well. Probably the most famous case of that would have been Pete Maravich. Pistol Pete played for LSU, New Orleans Jazz, really was an unbelievable athlete. And it turns out he had a congenital coronary anomaly where the major artery to the front of his heart was actually coming off the wrong area. It was coming off of the pulmonary artery. So it's being fed with blood from a vein rather than an artery. And that low oxygen tension over decades really did hurt his heart. Now, he went through a lot of other things, but he was able to perform at a high level despite having a relatively poor blood flow to his heart because he trained so well. And so hopefully that's the exception rather than the rule, but ultimately you're taking a big chance. It's best to keep your arteries clean and to keep your insulin levels very low so you're not actually developing the plaque that's going to hurt you later in life.
In terms of exercise, is that kind of like a Goldilocks situation where you can exercise too much, you can exercise too little, but then there's just the right amount of exercise that is the perfect for heart health?
Highly controversial. I will do a shameless plug for my former fellow, Sean Schweringen, who, if people are interested in this particular question about how much exercise is too much, he and I published an article, mostly he, in the International Journal of Disease Reversal and Prevention. That's ijdrp.org. And you can look him up about exercise. And there are some concerns about the number of deaths that happen with marathon runners. And pretty much everybody who qualifies to run a marathon is in shape, and yet they have a certain number. Typically, get 30,000 people running, 1 or 2 are going to pass away and if they don't get the CPR. And all the people are geared up at the organizer level to make sure that they have the ambulances that they need. Part of it has to do with overload of conditions of the heart that people don't know they have. And having a fitness test, going in to have your physical exam to clear you, may not hear that murmur that says that you have like hypertrophic cardiomyopathy. That's one of the major issues where the muscle is thick and gives a lot of rhythm disturbances. And most people of the lay audience wouldn't remember that if they're our age, or my age anyway, because Hank Gathers, playing for Loyola Marymount, if they Google it, they'll see what that condition was like and how it could have been treated, and he could have had a different outcome. But nowadays we have AEDs in all the gyms, and we have AEDs in all the marathons. And so you do have the extreme athletes coming up with cardiac events. A lot of the time when they're in their 40s, it really is coronary disease. It really is that they ate the plant, not enough plants and too many animals, and plugged the arteries, thinking that it was going to be okay because they're exercising a lot. Now, if the other side of it, though, is that the marathoners tend to actually have more buildup of plaque in their arteries, more calcium. Now, they do tend to do better with that level of calcium than the average population because their fitness level is high. And there's some theories, and let's just wait for more data to come out, saying that that isn't real plaque, that is just a response to the repetitive, having your heart rate go up and stay up for hours and hours on end, that is what's leading to the calcification. All we can say is that you'd rather not have calcified arteries. And so maybe there's some moderation where you can exercise with high intensity and maybe a little less duration and get the optimum. So the reason what's backing me up on this is people will be very interested, since our topic today was kind of like tennis, is that is the one sport that has, or the group of sports, racket sports, that has an amazing track record for decreasing mortality. Marathons do not. Football, this is from the British Heart Journal, so that's soccer for the Americans, does not improve mortality. Swimming is a little neutral to slightly beneficial, but racket sports actually do save lives. And so I've seen about 3 different articles. They're somewhere between a 40 to 57% decrease in mortality. Now you can argue, okay, wait a minute. We heard that with the Johns Hopkins Medical Group, that they compared baseball, football, basketball, golf, and tennis. The only 2 from medical school on, the only 2 that were played lifetime, were going to be golf and tennis. The other 3 sports get dropped by people when they get into middle age. And the only one with a mortality benefit was tennis. Well, that was not a great comparison. You have three sports that people won't play and one that doesn't a lot of oxygen consumption, plus a lot of stress, which is usually good for you. So maybe that wasn't a fair comparison. And maybe the British Medical Journal data isn't a fair comparison either, because tennis players have more money, or they're more strategic thinkers, or they are, if you're only people who play a long time are the people who are really good at it. And if you're good at it, you're good at a lot of other things. And they can't take into account all confounding variables about how diplomatic a person you are, because you learn those lessons on the tennis court, which is a real phenomenon. So it may be confounded, but the data is actually pretty clear. Dramatic decreases in mortality if you're playing tennis. So maybe you don't have to exercise so hard. Maybe it should be short bursts of intensity.
Real quick here, because I do want to hit on two other things before I let you go. I want to ask you if we can get some practical tips. I think that a lot of people are probably listening to this, watching this right now, saying, all right, well, they've talked in generalities. Let's try to give some specifics. Could you list off for people who want to improve their tennis game and their cardiovascular health overall, basically, what are some of the top foods you would recommend? And then what are the ones you would say, absolutely, positively get those off of your plate right now?
So the one thing that was popular in the 70s, people would say, I want to do a carb load. That probably isn't the best thing to do unless you're doing it early on, several hours before the match, and it's complex carb. Because, and actually at this tournament, there was an American player, I won't say his name, because he's a young guy, who actually was using a particular popular brand of candy bar during his match. He ended up losing, but I don't know, at his age, he's so young, he probably could get away with it. But to actually give yourself a fat load and a sugar load at the same time, you're decreasing vascular function, and that insulin rise is going to drive that blood sugar intracellularly, and you're going to feel pretty bad an hour later. So I would say that would be on the list of things not to do, is the sugary drinks and candy bars. But complex carbohydrates, even if you're doing fructose, which doesn't generate as much of that is, doing a banana, doing some kind of complex carbohydrate fruit, actually does work pretty well. And people can use that for the long matches. It's really important when you're playing 3 out of 5 sets to have something that you can go to that's complex, that isn't going to drive your blood sugar first way up and then way down. And it's going to make sure that you still have enough energy to keep competing.
All right. And then I got to ask you about the story of the Australian Open. I'm doing a little prep for this interview. I stumbled across an article that says, famed cardiologist saves fan's life. What is this story? 2017, this is a heck of a thing you're involved in.
Right. Well, it turns out that until COVID took over, I just got word that the Australian Open, sorry for any fans who hadn't heard this yet, Australian Open 2021 will have no international visitors. And so that's breaking a streak of 19 in a row. It wasn't just tennis. I was actually lecturing at the Society of Nuclear Medicine for Australia New Zealand Society of Nuclear Medicine, Victoria, Tasmania chapter. They were probably sick of hearing from me anyway, but I think a lot of the kids in the room, the young nuclear medicine technologists, were in kindergarten when I started giving those lectures. It turns out that the Australian Open has been a wonderful time to get away from Chicago. 2 weeks less winter, 2 weeks more summer. That's 4 weeks as far as I'm concerned. And so this one year in 2017, we were in the stands, and there was a gentleman who got up and immediately went down. And I keep my little EKG on my device on my phone, went over there to him, felt that he was pulseless, and started CPR. Now, fortunately, within about 90 seconds, he was awake and looking around, kind of stunned, and trying to push my hands off of his chest, which was great. So we got him up to the top of the stairs, and I just took my little EKG device, and it actually didn't look like a heart attack, because you sometimes can see EKG changes of a heart attack, but he had a normal rhythm. So when I got the whole story, it turns out that he had a little bit of claustrophobia, and he was sitting in the stands, very close to the front. But he was surrounded by people, and he just felt like he needed to get some air. And it turns out he was starting to get sweaty, starting to turn ashen, and those are the signs of so-called vasovagal syncope, where his vagus nerve just sent out this signal. Heart rate slows down, blood pressure goes to zero almost, and he went down. Fortunately, he probably and hopefully would have come out of it on his own, but the CPR probably helped a little bit to bring the blood flow back and get a little bit of adrenaline, which is the thing that you need to counter it. So it turns out he was fine. You know, obviously we don't name names of people, but he's actually a fairly famous guy, and he had a winery all over the world, including an office in Chicago. I don't drink wine, but he sent a couple of cases I could give away to people. So it's very nice. He didn't need to do anything like that for me, but just very happy to help and happy that he was okay.
Interesting interview, man. He loves Dr. Williams, just absolutely loves his tennis. You can tell that. If you would like to check out that full interview, you can head over to Apple Podcast or Spotify, wherever your favorite podcasts are available. Look for the Exam Room Podcast by the Physicians Committee. Hit that subscribe button and leave a 5-star rating. I think that you'll really enjoy it. That was about half of the interview. For the other half, go ahead and look for that on the podcast now. Time now, though, to welcome Dr. Jasmol Sardana to the Exam Room Live as we open up the doctor's mailbag to answer your questions. So if you have something that you would like to ask Dr. Sardana, go ahead and drop that in the comments now, or you can tweet that to @ChuckCarroll, WLC, or @PCRM using the hashtag Exam Room Live. Now, Dr. Sardana, before we take the first question, I would love to get your thoughts on what it was that Dr. Williams was talking about when I asked him which was more important, diet or exercise, when it came to heart health. I was really surprised when he said that it was probably nutrition by a ratio of 4 or 5 to 1. That's pretty substantial.
Absolutely. I think I 100% agree with that, because for me, as a lifestyle medicine physician, as a primary care doctor, prevention is worth everything. Prevention over treatment, prevention over cure. And again, we know, as Dr. Williams mentioned, there's just evidence, so much evidence out there to tell us how a plant-based diet is so protective when it comes to our heart health. So yes, I agree. I think nutrition trumps exercise is very important.
Yeah, and anecdotal evidence here. Someone on the show commented yesterday, actually. They said, I went plant-based about 2 or almost 3 years ago, but did not cut meat out of my diet entirely. I had a heart attack 18 months into the switch, though, and now I've given up meat. So I think that too goes to this notion that, hey, food is super, super important.
It absolutely is. I'm sorry that, it had to come to that, but thankfully, he had the opportunity to make that change.
Absolutely. All right. So let's go ahead now and open up that doctor's mailbag. Reach in and pull out a question. And the first one, Dr. Jazz, comes to us from YouTube. This person writes, I eat way too many nuts and I'm worried about how much saturated fat I'm getting. But I feel like nuts also, I need them because they're calorically dense. So do you have any advice?
Yes, absolutely. So this can be a bit of a controversial topic in plant-based nutrition. Nuts, for the most part, the evidence tells us that they are a healthy part. They're a healthy part of a healthy diet. And the piece that the person touched on is that they're calorically dense. So where it can become problematic is if you're getting a lot of nuts and you're not really paying attention to the portion size of the nuts that you're eating. In fact, nuts like almonds and walnuts are the ones that we know are, definitely beneficial. Nuts like cashews, which do have some saturated fat in it, and as we know, saturated fat is linked to increasing LDL, or the bad cholesterol, can be problematic. So it really also just depends on the type of nuts that you're eating as well. It can be, part of a healthy diet, but pay attention to the portion, pay attention to the size. The type of nuts that you're eating, but it can be incorporated into a healthy diet.
It's Question kind of along the same lines. This one comes to us from Dinah on Twitter. She writes, I've been eating a whole food plant based diet for many years and keep fats low, except for less than 2 tablespoons of almond butter and occasional tofu. My blood pressure, though, is still not where I would like it to be. Could the fat from the nut butter and tofu be contributing to this? If so, should I ditch them?
Yeah, that's really tough, because at this point, I feel like I'm being really picky with your diet. If I don't let you, if I say you can't even eat your tofu because of your high blood pressure, that's really tough. My gut feeling here, certainly I don't know all of the details of your diet, but my gut instinct is to probably look at other things first, apart from if you're just getting that, that minimal amount of nut butter and you're getting a healthy amount of tofu. I doubt that that's what's causing or contributing to your high blood pressure, unless you're adding things to it. If it's salted, if there's other seasonings that could potentially raise your blood pressure, then you want to look into that. What I'd probably turn your attention to or to ask about is, are there any processed foods in your diet at all? Because we know things like even commercially processed breads are our number one source of sodium in our diet. So paying attention to that first before talking about the nut butter and the tofu is probably what I would recommend. And then the other piece, we vilify sodium, and certainly we do get way too much of sodium in our American diet. We don't talk enough about potassium and how it actually can counterbalance the effect that sodium has on our high blood pressure. So reaching for those foods, as long as you don't have any other underlying conditions, and certainly speak to your doctor about this, but choosing potassium-rich foods are another way to help manage your blood pressure.
Dr. Jazz, this one comes up time and again, a lot recently, in particular here on the show, from Tracy now on Facebook. She writes, should we be supplementing with iodine? And if so, how should we do it?
Great question. So the quick answer is no. What is so important about iodine? Iodine is a nutrient, obviously, that our body needs. And why we need it is because it is fundamental to thyroid function. Our thyroid is a gland that sits in our neck. It helps to manages the metabolism in our body and affects so many things. And iodine is needed to convert the inactive form of thyroid into the active form and for all of these functions to happen. In a vegan diet, iodine is usually found in iodized salt. Sorry, not in a vegan diet, but in general, iodine is usually we get it from our diet through iodized salt. Sometimes in seafood if you're not vegan. However, on a vegan diet, if you're limiting salt and if you that there might be a concern about iodine deficiency. To that, I would say try to consume sea vegetables. That is a plant-based source of iodine that's rich in iodine and that's healthy. And so choosing a whole food like delicious sea vegetables and getting that a few times a week is what I would recommend. Everybody needs a consistent source of iodine. So if you're finding that you're not able to get those sea vegetables in on a consistent basis and you're not, choosing to use salt or iodized salt in your cooking, then a supplement might be needed. But again, that's a discussion to have with your physician.
All right, here's one from Barry on Facebook today. This is a really interesting one. Maybe some other people are struggling. Barry has been struggling to exercise because of a lack of sleep. He says he's having trouble with sleep apnea, but he says that his food is good and clean and plant-based. However, he says that he eats too much and his food has too much salt. So what are some tips you can give Barry to get going on a better track?
So Barry, this is such an important piece. Sleep is so fundamental to health, in restorative health and healing. And so, if you already know that you're getting in a lot of salts, if you're eating really late into your night, that could be contributing to excess weight. And we know that those who have excess weight, who are obese and overweight, that can lead to, and that is a risk factor for something called sleep apnea. And sleep apnea is when our bodies essentially stop breathing and we wake up multiple times during the night without even being aware of it. And when we're doing that, we never really get into that deep part of our sleep so that we're feeling refreshed and restored the next day. So that is kind of the link between your diet and weight and sleep apnea and how, tired and unproductive you might be feeling. So my recommendations would be to cut back on the salt, to to move up your dinner time and to limit snacking before bedtime for sure. And to be sure that you're choosing foods that are not calorically dense, that are not processed. All of those things are really important when it comes to keeping a great or normal BMI and reducing your risk of sleep apnea.
Practical, great tips from the lifestyle medicine expert. We ought to do more lifestyle stuff with you here on the show, Dr. Jazz. So why don't we coordinate something to make that happen?
Let's do it. I'd love to. Love to.
All right. If we didn't get to your question today, have no fear. We will save it and try to get you an answer, I should say, on an upcoming episode. Keep on sending them in the comment section or send us the question on Twitter as well using the hashtag ExamRoomLive. And if ever you have a question that you would like to ask Dr. Jazz or any one of our doctors or dietitians privately, you can do that over at the Barnard Medical Center. Just log on to barnardmedical.org or pick up the phone and call 202-527-7500 to schedule your appointment today. They can definitely help get you on that path to better health. You see that web address and phone number on your screen again right there, 202-527-7500 or barnardmedical.org to make that appointment today. Log on there and get a full list of states where telemedicine appointments are available. And say, if you liked this show today, go ahead and like the Physicians Committee's Facebook page and YouTube channel if you haven't already done that as well. Now, coming up tomorrow, we are going to be doing something a little bit different on the vegan side of things. We're going to be looking at some disturbing experiments that are being conducted by SpaceX and Tesla CEO Elon Musk. So the question is there a way to advance medical science that does not involve harming animals? We'll discuss that with Dr. Neil Barnard and Dr. Ann Lamb. Join us back here on the Exam Room Live. But for today, we are all out of time. My exam roomie, thank you so very much for tuning in today. And to Dr. Jazz, Dr. Jasmol Sardana, thank you very much for sharing some of your time with us today as well. And of course, to the best crew in all of the biz, thank you guys for helping to make this show possible. For everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thanks so very much for tuning in. And until tomorrow, stay safe, take a stand, and keep it plant-based.